Here is something that almost nobody talks about, and honestly, it should be on the front page of every health magazine in America. Every single day, millions of Americans over the age of 60 take their medications exactly as prescribed, doing everything right, trusting the system, trusting their doctors, and trusting that what is in that little pill bottle is helping them live longer and feel better. And for many of those people, that trust is well placed. But here is the part that will stop you cold. According to research published in the Journal of the American Geriatric Society, older adults are hospitalized at a dramatically higher rate due to adverse drug reactions than younger adults. In fact, some studies estimate that nearly 1 in 3 hospital admissions in people over 65 are directly linked to medication-related problems. Not illness, not accidents, medication. The drugs they were prescribed to protect them. Now, here is what makes this even more alarming. Many of these reactions are not caused by rare medications. They are caused by some of the most commonly prescribed, most trusted, most widely used medicines in the country. Drugs that are sitting in bathroom cabinets and kitchen drawers all across America right now. Drugs that have been taken for years without anyone questioning whether they are still safe, still appropriate, or still necessary. So today, we are going to talk about 5 of those medications. 5 categories of drugs that, according to geriatric medicine experts and pharmacists who specialize in older adult care, carry risks that most patients over 60 have simply never been told about. And I want to be absolutely clear right from the start. This video is not telling anyone to stop taking their medication. That decision belongs to you and your doctor. What this video is doing is giving you the knowledge you deserve so that the next time you sit down with your physician, you are asking the right questions. Because in medicine, the most powerful tool a patient has is an informed conversation. And too many people over 60 are being left out of that conversation entirely. So let us start with the first one. And this one surprises people every single time. Sleeping pills and sedatives, particularly the class of drugs known as benzodiazepines, which include medications like Valium, Ativan, Xanax, and Klonopin, as well as the newer so-called Z drugs like Ambien and Lunesta. Now, sleep problems are incredibly common in older adults. Nearly half of people over 65 report having some kind of sleep difficulty, and it is completely understandable that when a doctor offers a prescription to help, most people take it. Sleep is essential. Poor sleep is genuinely harmful. Nobody can argue with that. But here is what the science has been telling us for years, and what the American Geriatric Society has been loudly warning about through something called the Beers criteria, which is a list of medications considered potentially inappropriate for older adults. These sedative medications affect the brain and the body very differently in someone who is 65 or 75 compared to someone who is 35. As we age, our liver and kidneys process medications more slowly. This means drugs stay in the system longer. The sedative effect lingers. And the result is something that doctors call the next-day hangover effect, which sounds manageable but is actually quite dangerous. Studies have found that older adults taking these medications have a significantly elevated risk of falls, and falls in this age group are not minor events. A hip fracture in someone over 70 can trigger a serious chain of health decline. Beyond falls, long-term use of benzodiazepines has been associated in multiple studies with cognitive decline and increased risk of dementia. And perhaps the most uncomfortable truth here is that many people who are currently taking these medications were prescribed them for short-term use, maybe 2 to 4 weeks, and simply never stopped. They were never told to stop. Nobody followed up, and now years have passed. If this sounds like your situation or someone you love, that is not a moral failure, it is a systems failure. But it is absolutely worth a direct conversation with your doctor about safer alternatives, behavioral strategies for sleep, and whether a gradual tapering plan makes sense. The second medication category might genuinely surprise you because this one has an image problem in reverse. Most people think of it as completely harmless. We are talking about nonsteroidal anti-inflammatory drugs, or NSAIDs. This includes over-the-counter names that are in every household: ibuprofen sold as Advil and Motrin, naproxen sold as Aleve, and various prescription-strength versions. For decades, these drugs have been the go-to solution for pain, inflammation, arthritis, headaches, and general aches. And for a younger person in good health, occasional use is generally considered safe. But for someone over 60, the risk picture changes significantly. Here is what happens inside the body. NSAIDs work by blocking certain enzymes that cause inflammation, but those same enzymes also protect the lining of the stomach and the kidneys. In a younger, healthier body, this trade-off is usually manageable. But as we age, kidney function naturally declines, and the stomach lining becomes more vulnerable. Regular NSAID use in older adults has been strongly linked to gastrointestinal bleeding, which can happen without obvious symptoms until it becomes serious. It has also been connected to kidney damage, elevated blood pressure, and increased risk of heart attack and stroke, particularly in people who already have cardiovascular risk factors. The truly scary part is that many people over 60 are taking these drugs every single day for chronic pain, not realizing the cumulative damage that can build up over months and years. And because ibuprofen and naproxen are available without a prescription, they do not always come up in medical conversations the way prescription drugs do. Doctors sometimes are not even aware their patient is taking them regularly. This is exactly why you should always tell your doctor every single thing you take, including over-the-counter medications, vitamins, and supplements, because what feels harmless can interact in ways that are genuinely dangerous. Now, we are getting to number 3, and this one involves a class of medication that millions of older Americans rely on every day for their heart. Blood pressure medications, and more specifically, certain types of diuretics and calcium channel blockers that, while often necessary and life-saving, require a level of monitoring and adjustment that many patients simply are not receiving. High blood pressure is extremely common as we age. There is no question that uncontrolled hypertension is dangerous and that treating it saves lives. That is not the debate here. The issue is something called orthostatic hypotension, which is a medical term for what happens when blood pressure drops suddenly as a person stands up from sitting or lying down. In older adults, especially those on blood pressure medications, this sudden drop can cause dizziness, lightheadedness, and falls. And again, we come back to that danger of falls in this age group. But here is another layer that makes this issue especially important. Blood pressure targets that were considered appropriate for younger adults are now being re-examined for older patients. Some research suggests that aggressively lowering blood pressure in people over 75 can actually increase the risk of certain negative outcomes, including kidney injury and, in some cases, cognitive problems related to reduced blood flow to the brain. The recommendation is not to stop treating blood pressure, it is to treat it at the right level for your age, your specific health profile, and to make sure your readings are being monitored regularly, including checking blood pressure in both sitting and standing positions. If you get up in the morning and feel dizzy or unsteady, do not brush it off. Tell your doctor. That symptom alone is worth a medication review. We are halfway through our list, and I want to pause for just a moment because I am hearing from people in our community that these conversations are genuinely changing how they approach their health appointments, and that is exactly what this channel is about. So if you are watching this and something is clicking for you, something you have been wondering about or suspecting but never knew how to bring up, drop a comment below and tell me what it is. Because these conversations are important, and your experience might help someone else who is watching this video right now. Now let us keep going, because number 4 and number 5 are ones that almost nobody expects to hear on this list. Number 4 is a category that touches a very sensitive subject, and I want to handle it with the care it deserves. We are talking about proton pump inhibitors, commonly known as PPIs, which are medications used to reduce stomach acid. Brand names include Nexium, Prilosec, and Prevacid, and there are also widely available generic versions. These are among the most prescribed medications in the entire country, and many people take them for years to manage acid reflux, heartburn, and conditions like GERD. Now, for someone dealing with serious acid-related problems, these medications can be incredibly helpful. Nobody is disputing that. But the research over the last decade has raised some significant concerns about long-term use, particularly in older adults. Studies have found associations between prolonged PPI use and reduced absorption of critical nutrients including magnesium, calcium, and vitamin B12. Why does this matter? Because magnesium deficiency in older adults can contribute to muscle weakness, irregular heartbeat, and neurological symptoms. Calcium absorption issues raise concerns about bone density and fracture risk. And B12 deficiency can cause serious neurological problems, including symptoms that can actually mimic early dementia, memory problems, confusion, and balance issues. There is also emerging research suggesting a possible link between long-term PPI use and increased risk of kidney disease and certain infections. None of this means that everyone taking a PPI should stop immediately, but it does mean that if you have been on one of these medications for more than a year, or if you cannot even remember why you started taking it, that is a conversation worth having. Many people are prescribed a PPI during a hospital stay, a period of stress, or while taking another medication that irritates the stomach, and they simply never come off of it even after the original reason has resolved. And now we arrive at number 5, and I genuinely believe this one is the most underappreciated risk in older adult health. We are talking about anticholinergic medications, and I know that sounds technical, but stay with me because this matters deeply. Anticholinergic drugs work by blocking a chemical in the brain and body called acetylcholine. This chemical is involved in memory, thinking, muscle control, bladder function, and many other critical processes. The reason this category is so important is that anticholinergic effects are found in a surprisingly wide range of medications that older adults commonly take, many of which people do not even think of as serious drugs. This includes certain antihistamines found in common sleep aids and allergy medications like Benadryl, certain bladder control medications, some antidepressants, certain medications for dizziness and motion sickness, and even some gastrointestinal drugs. The older you get, the more sensitive your brain becomes to anticholinergic effects, and the consequences can be alarming. Short term, these drugs can cause confusion, memory problems, constipation, urinary retention, and increased heart rate. But the longer-term concern is even more serious. Multiple large studies, including a significant one published in JAMA Internal Medicine, found that high cumulative exposure to anticholinergic drugs was associated with a notably increased risk of dementia. And the truly difficult part of this problem is that anticholinergic burden, which is the total effect of all the anticholinergic drugs a person is taking combined, is often invisible to individual doctors who only see part of the picture. A primary care doctor prescribes one medication, a specialist prescribes another, and nobody is sitting down with the full list and calculating what the combined effect looks like inside this specific patient's aging brain. This is why medication reviews, sometimes called brown bag reviews, where you literally bring every single pill, supplement, and over-the-counter product you take to one appointment, can be genuinely life-changing. Geriatric medicine specialists and clinical pharmacists who specialize in older adult care are trained to look at the whole picture, and if you have access to that kind of consultation, it is absolutely worth seeking out. So let us bring this all together, because knowing the risks is only useful if it leads to action. The 5 categories we discussed today, sedatives and sleeping pills, NSAIDs, certain blood pressure medications, proton pump inhibitors, and anticholinergic drugs, are not on this list because they are bad medications. They are on this list because they are medications that carry specific elevated risks for older adults that are often not being communicated clearly enough and that are not being monitored as closely as they should be. The healthcare system in this country is not designed to give every older adult the individualized, comprehensive medication review that they deserve. That means patients have to be their own advocates. It means bringing a complete list of everything you take to every appointment. It means asking your doctor directly, is each of these medications still appropriate for my age and my current health? It means asking whether there are lower doses, safer alternatives, or whether some medications can be gradually tapered or discontinued. And it means never stopping a medication cold turkey on your own without medical supervision, because some of these drugs require a careful, guided process to come off safely. You deserve to understand what you are putting into your body and why. You deserve to have an informed conversation with your doctor rather than simply accepting what has always been prescribed. And you deserve to know that asking questions is not disrespectful or difficult. It is the single most powerful thing a patient can do for their own health. Now here's where I really want to hear from you. Have you ever had a doctor sit down with you and review all of your medications together as a complete picture? Have you ever experienced a side effect that you later realized was from a medication you had been taking for years? Maybe something you thought was just aging, fatigue, memory issues, dizziness, that turned out to have a pharmaceutical explanation. Drop your experience in the comments below because I read every single one, and because your story might be the thing that convinces someone else watching this video to have the conversation that changes their health. Share this video with someone you care about who is over 60, because the information in this video could genuinely make a difference in someone's life. And if you want to keep learning about how to navigate your health after 60 with real, evidence-based information that respects your intelligence and your experience, make sure you are subscribed and have notifications turned on, because we have a lot more coming. Your health at this stage of life is not something to manage on autopilot. It is something worth understanding deeply, protecting actively, and advocating for loudly. You have earned that.